What is spinal decompression? Great question. It's also known as vertebral axial decompression. And to understand how it works, got to understand a little bit about the spine. Vertebrae can and do shift out of position, and this puts pressure on the nerves as it exits the spine. Also, our entire upper body weight is just crushing this small disc in the low back, about 2 inches wide. Things like bending, twisting, standing, sitting for long periods of time, all of our activities of daily life affect this disc. In our cervical spine, okay, we are in a constant state of cervical flexion because of modern technology. We've got cell phones, computers. In fact, a phrase has been coined called text neck that is related to a lot of neck pain and symptoms. Did you know the two most common segments in the entire body that require surgical intervention is the L5 and C5 for these exact reasons? Our daily life just grinds down and crushes these areas. Not only does spinal decompression feel amazing, but doesn't it just make sense to use a force to counteract all these compressive forces? What could be better? When we counteract the force that are causing spinal issues in the first place. The research shows that the nerves that exit the spine become compressed or irritated when we get things like spinal degeneration, arthritis, degenerative disc disease. As those discs wear out and we irritate these nerves, it can cause back pain, shooting leg pain, numbness and tingling, neuropathy. In fact, it can even affect the bladder and bowels. It can cause issues with the colon and a host of other issues. Long story short, the nerve power coming from the spine has to be free of irritation and be able to flow freely, to be symptom free and to be able to function at our best. So what we want to do, of course, is get our chiropractic adjustments to make sure the vertebrae are aligned as best as possible and moving the best. But also, a fantastic thing is to do the spinal decompression to counteract all these compressive forces that we experience through our day-to-day life. In fact, my job is hard on my body. I'm constantly leaning over, adjusting patients all day long. And since I've been doing spinal decompression weekly, I haven't felt better. In fact, just thinking about it right now makes me want to go get on the table. Anyways, I hope that gives you a little better explanation of how spinal decompression works, why it feels amazing, why it works. I just want to remind you, my mission is to just help all the people we can live healthier, pain-free lives. Have an awesome day.